We are discussing a topic that is often overlooked in both research and clinical practice: falls in individuals with cerebral palsy, or CP. As my colleague and lead investigator Liz Boyer puts it, the study was inspired by parents and their children with CP evaluated in the clinical gait lab who reported frequent tripping and falling. Despite this, there is very little research on falls for these individuals and no evidence-based clinical practice guidelines for fall prevention. When we think of falls, we often think of injuries. Injuries are a concern, but Liz learned about the lesser-known psychological impacts of falls through other qualitative studies and by talking to adults with CP when designing our study. Those studies and conversations shaped the study questions so we could learn more about holistic fall experiences and what we can do to address this somewhat taboo topic. Our study explored the lived experiences of 316 ambulatory children and adults with CP, ages 5 to 76, who walk with or without the use of assistive devices. Participants responded to open-ended prompts about the physical and emotional impacts of falling, balance, confidence, avoidance, and adaptation. Additionally, participants reflected on how clinicians, families, and society can make physical and social environments safer or decrease their concerns about falls. This qualitative approach allowed us to have a deeper understanding of the complex and multifactorial nature of fall experiences across the lifespan. To provide real-life context to the findings presented in our paper, I would like to introduce Kari Pederson, co-author and an adult living with CP. Her insights, along with our other co-authors with lived experience, were central to shaping both the direction and interpretation of this work. Take it away, Kari.
Marissa, thank you so much for this chance to talk with you about our research on falls. I love discussing the insights that emerged from our study. I'm also privileged to have been a mental health clinician for 25 years, so my perspective is influenced by what I've learned from other children, adults, and families who live with CP every day. Even though falls are a common occurrence when you're ambulatory and you also have CP, some of us even joke about being expert fallers. The actual chance to discuss falls is rare, except for the routine conversations we sometimes have about fall prevention.
Can you elaborate more when you say it's rare to have the opportunity to talk about falls?
Sure. Generally, I think most people aren't sure what to say about falls. And because they don't want to say the wrong thing, they just don't ask about falls at all. I think healthcare professionals have a golden opportunity to initiate supportive conversations about falls. But those conversations need to happen with caring intention and a strong focus on listening and learning from your patient's experience. Falling is a deeply personal subject for most people with CP, and their fall prevention needs are going to constantly change over their lifespan. Our research also highlighted that many people worry about the potential loss of their independence, having assistive devices pushed on them before they feel ready, attending social events with large crowds, or feeling like a liability because of how others might view their falls.
Kari, you've mentioned your favorite finding from our research was the request to let the faller decide if they wanted help or how they wanted help given after a fall. Can you share specific details?
This is my favorite finding, and I'm so excited to talk about it. Waiting to help when someone falls near you isn't always easy. But let the person who's fallen decide what help they want, or if they want any help at all. Fallers need to reestablish autonomy over their own bodies, and many of us have experienced how scary it can feel to have someone grab you or pick you up, especially by a stranger. We also might need time for our muscles to be ready to stand or to assess if we have a serious injury. Well-meaning bystanders tend to want to rush the process of getting him back up because culturally, I think we feel like the person is okay once they can stand again. But the faller actually needs bystanders to be patient and give them control over what help they accept. Maybe somebody just wants you to stand by while they try to get up on their own, or use your hand or knee as something to pull up on, or be willing to call 911 or go for help if needed. Marissa, I also want to underscore something you mentioned in your intro about the lesser known psychological effects that can come from falls. Many people in our study talked about feeling anxiety, shame, or embarrassment after they fell, especially when they fell in front of another person. Even if you jump right back up after a fall, you might still have psychological impacts that can linger and may cause fear, avoidance, or negative impacts to your self-image.
Thanks, Kari. I agree that psychological impacts are very important to highlight when discussing falls. I would now like to open our discussion to Nate Wandersee, who is another co-author and an adult living with CP, to highlight feelings around falls. Take it away, Nate.
Thank you, Marissa and Kari. I'm excited to be here today. A little background about myself. I'm 53 years old and live by myself in a condo in downtown St. Paul, Minnesota. Poor vision and slow reflexes made it very dangerous for me to drive. I got my driver's permit at age 16, but never got my license. So I walked to work most of my life. I have a 3/4 inch lift in my right shoe due to a leg length difference that wasn't discovered until I was about 25 years old. The day I got the shoe lift was the happiest day ever for me in physical therapy. I wobble less and feel more stable since receiving my shoe lift. I've lived with a fear of falling since middle school. When I first noticed my fear of falling, the worst part of it was if someone saw me fall. In more recent years, even walking to work without fear of falling could be a major challenge. When my fear of falling was at its worst, I felt like all I did was go to work, come home, and do physical therapy. I shut many of my friends out because I did not want them to see me struggle. I was very stubborn about not using an assistive device to help me walk. In my mind, fear of falling and fear of physical decline are closely related. The advice I would give my younger self: if using an assistive device to help you walk keeps you safer and adds to your quality of life, use it. I'm thankful to have been seeing a sports psychologist for 10 plus years to help with goal setting and feelings of anxiety and self-doubt. One thing I want everyone to realize is if someone falls, it doesn't affect just the person who fell, but also the people that love them. A quick note on accessibility. I and many people in our study want more accessible bathrooms and showers and better designed public spaces to reduce fall risk. Simple additions include more handrails, but they have to be in the right spot. I've been in too many hotel showers where the grab bars seem miles away from the shower chair and are useless. To wrap up, there is so much I want to see and do in life. I can't do those things sitting on my couch. We all want to live life to the fullest, which will be easier if we don't have to worry so much about falling.
Thanks again to Kari and Nate for sharing your insights and wisdom. We hope this conversation and our research sparks more honest, supportive, and thoughtful discussions and compassionate care around falls for people with CP.